In medical news, a new study has started a debate about colonoscopies, long regarded as the gold standard of screening for colorectal cancer. The study published in the New England Journal of Medicine found that participants who were offered a colonoscopy had only 18% lower rates of colon cancer. Researchers say those patients had about the same risk of death from the disease 10 years down the line. CBS News chief medical correspondent, that's Dr. Jon LaPook, is with us. He's a gastroenterologist.
I'm a doc.
You're my doctor, so I even know all of this. But listen, this is certainly your area of expertise. The headlines can be very jarring. What's your take on it?
I think the headlines were misleading.
Do you?
Big study. One group was just followed. The other group was offered a colonoscopy. You heard about the statistics after 10 years. About an 18% decrease in the risk of getting colon cancer, but no difference in mortality. But only 42% of the people offered a colonoscopy actually got it. Of the people who got the colonoscopy, there was a 31% decreased risk of colon cancer over about 10 years and a 50% decrease in the risk of mortality, risk of dying from colon cancer. So
a lot of numbers there, though, John. So
okay, so
bottom line it for us. I mean, if somebody is thinking, well, now I don't really need to do it, or I'm reluctant to get it, what are you saying?
Get it. This still is the gold standard. You know, it's not enough to be offered a colonoscopy or offered a test. You have to actually do the test. Now, I spoke to the author who was in Norway, a lot of statistical issues, and we can go over this fancy schmancy analysis. Okay, was it long enough, 10 years, to see a benefit in terms of mortality? Were the colonoscopists good enough, the people who did the colonoscopy good enough at picking up polyps and things like that? But the bottom line is a colonoscopy is a great way, the best way we know of preventing colon cancer. You know, you go in there, I've done many, many thousands of them, you find a polyp, and that polyp has the potential to turn into colon cancer over time. You take away that polyp, you remove it, and instead of potentially getting colon cancer, you don't get colon cancer.
Quickly, what's the age you should get it?
First screening at 45 if you're at average risk, and if you're at increased risk, lower than that, talk to your doctor about, your healthcare professional about exactly the timing.
Dr. Jon LaPook, we appreciate you giving us the bottom line, no pun intended.
Yes.
Thank you so much.